Hi everyone, welcome to another episode of House of Cure presents Doc Talk. This is the 13th episode, and today we're going to be discussing spinal manipulation therapy with our physiotherapist, Dr. Sudarshan Singh. It's an absolute privilege talking to him. Uh, Thank you so much for being on the show, sir.
So thank you so much, Karan, for having me here in this series of yours. So I'm delighted to answer all your questions regarding spinal alignments and whatever it may. Yeah. So let's go ahead.
So, getting right to it, what is spinal manipulation? There's a lot of confusion going around regards to what it is. People see a lot of videos, they get very attracted to the entire concept, but I'm sure not a lot of us really know what's happening, with the therapy. So, so could you clarify our doubts, please?
So, spinal manipulation is basically, something where human spine is involved in every movement that we do, whether it is our daily activities or it has to do something with running, cycling, or anything. So, spinal manipulation basically helps you to improve these movements. It actually helps you to kind of, take up to the next level where you can use these movements in all parts without any pain or any sort of problem or disability. Normally, what I have seen is that people start labeling these issues as major neck pain or probably even a cervical spondylitis or a lumbar spondylitis. We need to realize that just a little bit of movement here and there can help you and take you to the next level without even kind of getting into the regular series of medicines or anything of that sort. Probably a little bit of movement and exercise can really help and go the long way.
The next question that we asked Dr. Sudarshan was who all can benefit from this therapy? Is it age specific? Is it gender specific? Do people with problems, spine problems, are the only ones who can benefit from it? What's the take on that?
People who can benefit from spinal manipulations, this is typically people from 20 plus to even 50, or we have actually done spinal manipulations for people who are at even 80, and they have benefited. But if I look at the major chunk of people, it's between 20 to 50, where they see the movements, they can actually appreciate that movements have changed after the spinal manipulation. And for people who have neck pain, who have stiffness, who have back issues, who have issues related to the shoulder, because spinal alignment is not just about the spine, it is also about mobilization of other body parts like shoulder, wrist, and elbow. So basically, if you're suffering from any kind of joint pains, I think this is a good solution.
Despite the fact that spinal manipulation therapy is a very old science, there's still a lot of fear surrounding it. So we want to ask Dr. Sudarshan, is this fear justified at all? Or why should people not be afraid of getting spinal manipulation therapy done?
So I think most of the movements that we do are absolutely natural. Okay, if you really go to see the problems that can arise due to spinal manipulations, this is a hundred-year-old science. Okay, and if you look at the number of cases till now, you don't have more than 5 to 10 cases which have been reported in all these years, and the incidence of injury is 1 in a million. Okay, which is much lesser compared to a spine surgery, the risk related to a spine surgery. So frankly, if you see the spinal manipulation, the risk factors are much lesser compared to even a spine surgery. So I would say that it is absolutely safe, and most of the movements that we do are completely natural. It's not against. We are not moving the neck, or we are not moving any body part against their natural movement. All we are doing is we are trying to emphasize and improve this movement and take it to the next level.
Dr. Sudarshan has treated well over 1,000 patients now with spinal manipulation therapy. So I want to know what his personal experience has been in his entire journey so far. What are the common problems that he has seen that the Indian population faces on a day-to-day basis, especially with the work from home culture kicking in. A lot of us just sitting at home and watching, you know, staying at the same place and working on our laptops or watching TV or on a laptop. So, what is his personal experience been?
My personal experience with spinal manipulation is that it has given amazing results for people who are between the age group of 20 to 45, 50. Okay, uh, just helping them realize that these are the kind of people who don't want to go to a doctor and take some medicines because they feel that it is too old for them to do that, which is and they don't want to even get into that cycle of medicine. So they want to understand what is the alternative therapy. So when they do this spinal manipulation, and when I show them a few exercises that can really help. So this is something which I have seen recovering very well with this kind of population, where at times I feel sad because there are people who come in with their MRI reports, and they are just 25 or 27, and the MRI report says that they have some major neck problems, and they have some major cervical disc issues, and that is what they label themselves as. They fail to understand that these things can be better. It's not that people who have a MRI problem or who report an MRI issue will face the problem. I can tell you that there are so many people who do not complain at all, but if you take a MRI for them, they will also have some of the other issues which can report in the MRI, but they are not complaining. So we need to understand, why are these guys complaining? The problem is related to the lifestyle. The problem is related to the posture. The problem is related the way we carry ourselves. So if we do that right, which is a major portion of our therapy, if we do that right, I think this is what people, the youngsters or the people who want to exercise are looking forward to, and they're very happy with this kind of treatment. This treatment doesn't work for people who look for miracles. Okay, I don't say that people who are advised knee replacements or people who are advised spine surgery will get 100% better with this. They may have a little bit of improvement in their present symptoms, but I don't say that it gets 100% better, because nothing of that sort works. After a certain age, you have to understand that exercise plays a crucial role. Your regular movement does plays a crucial role. So it's this is the age group that really works. So common problem that I have seen is people who are spending a lot of time on desktop, people who are spending a lot of time on the mobile without realizing, having a forward neck, a lot of neck bending in their posture, and basically this is what we call early cervical spondylitis. But that is only a structural report on an MRI that is presented. Okay, what matters here is that the posture. If the posture is not correct, that is where they have problem. And I can see that 90% of people are carrying bad postures. So the moment we start getting this right, things do start working. For that matter, simple things like even the way we stand and the way we walk. I have seen so many patients who actually don't know that they have flat foot. Okay, so once I check them, and when I inform them that you have a flat foot and it is good for you to wear a shoe, so that is where it strikes them the importance of a flat foot and how it can create, or rather create a lot of problem for the biomechanics for the whole spine. So these are the kind of people, and yeah, the experience is really good that way.
With all of our doubts cleared, I thought it'd be great to ask him what his final take home message would be for anybody viewing this.
Don't give up so easily on your body, whether you are 50, whether you are 25, or you are 60. You still have capabilities. All it matters is how much do you want to stretch. Don't take your symptoms or don't take your problems so seriously. Okay, you have to keep giving it another shot. You never know what can work for you, so keep working on that.
Well, thank you so much for your attention, guys. Thank you so much for your time for watching this video. I hope it has helped. If you like the video, please go ahead and share it with as many people as you like, because it really helps us get this information out there to people. And that's the whole aim of Doc Talk, to educate the general population about all these medical fields and all its tiny nuances. So it'll be great if we could see your support in a like, subscribe, or a comment. Thank you so much, guys.